Hi, I'm Katrina Webb, founder of New Day and your podcast host. In each episode, we'll speak with ambitious leaders from around the world who are creating meaningful change and inspiring leadership for the greater good. Their stories will spark your own leadership journey and offer practical tools to help you lead with purpose and impact. Today, I'm joined by Dr. Tom Nehmy, a clinical psychologist, author, and long-term contributor to conversations about mental health, meaning, and how we live well. Now, Tom is an award-winning clinical psychologist based in Adelaide and one of the directors of the Healthy Minds program, an evidence-based preventative psychology approach that he developed over years of research to help people build resilience, well-being, and performance before challenges arise. He first became widely known for his amazing book called Apples for the Minds, which I absolutely loved. And it helps to make psychological well-being more accessible and practical for everyday life. And over decades of his clinical practice, his work has continued to evolve, deepening into bigger questions of grief, love, mortality, spirituality, and meaning. Now, his latest book, Inspired Life, Beautiful Death, explores how an honest relationship with death can help us live with greater clarity, courage, and presence. So Tom holds, throughout his work, this amazing space of science and spirituality, holds them together in a way that feels grounded, humane, and deeply thoughtful. Tom, thank you so much for being here on our New Day podcast today.
Thanks, Katrina. I'm so excited that you've got this podcast happening, and I'm even more excited to be on it.
Yeah. I know, Tom, first question, I did ask you to say yes, what drew you to be able to come and have a chat today on this podcast?
Well, first of all, it's my alignment with the New Day mission. It's about the greater good. And having been part of your 2019 conference, I think it was, at Adelaide Oval, which I just loved. And I feel in my work that I have this really, I'm compelled to share some of these messages because I think they can help a lot of people. And so whether it's doing workshops or giving a keynote or writing a book, I just love getting these messages out there.
Wonderful. Well, I was so excited that you said yes. And we are recording this at the start of a new year. And I wanted to, ask you, as you're rolling into this new year, what's on your mind? And I know some people come up with a word for the year. What's sitting with you as we start this new year, personally or professionally?
I think it's about courage. The older I'm getting and the more I'm delving into the things that really matter, I think it's just about heading in the direction that you know you're meant to go. And I've had this strange feeling at various points in my life where I'm guided or directed, or I just feel compelled to head in a particular direction. This is one of the things that led me down the path of becoming a grief therapist, which is, 10 years ago, if you'd said to me, you're going to be a grief therapist, Tom, in addition to my Healthy Minds work, I would have said, jump in the lake. There's no way that would happen. And yet here I am. And so courage is a big one. The other thing I found myself saying to people a lot just recently is calm is overrated. Because I think when we're, exhibiting courage, we're stepping out of that comfort zone and doing things that are new or a little bit different or pushing a boundary, it's not going to always feel comfortable, and that's okay. So I think those two things are going to put me in good stead for the year ahead.
Oh, I love that. Calm is overrated. And you're right. When we do step into that courage of, trusting or working in alignment or doing different things, it might look a little bit calm to some people, but underneath it can feel very uncomfortable for a while.
It's almost inherent to personal growth. Like we kind of get these messages, and I'm a bit of a contrarian, Katrina, when it comes to a lot of popular ideas in psychology. But one of the myths out there is that being mentally healthy is about feeling calm and in control all the time. And some of my professional colleagues, I think, from time to time, walk a pretty fine line with their clients by suggesting that feeling calm is the ultimate outcome of having it all together and being on the right track. But if you think about it, how often is it that people do something that is new, different, important, or carries responsibility and felt perfectly calm? It's just not natural. So it's inherent to our growth that we're going to be feeling uncomfortable sometimes. And my view now is let's just embrace it. As long as you're heading in the right direction, it's okay.
Yeah. Tom, I used to have that actually when I used to think about what I want to be known for. And maybe the word I was looking for wasn't calm, but I would use it. It was more about, being able to stay grounded and aligned and present. Doesn't mean it was easy, but it was finding a way to remain in that groundedness when things did get tricky. And I did some trauma informed training last year with an amazing yoga teacher. Actually, it was called trauma informed yoga training, and I did 50 hours. And she mentioned that she used to have that same thing about being calm, but a shift for her was this beautiful word from instead of calm to connected.
Mm,
And for her, it meant that she was connected to how she was feeling. And if she was feeling stressed or overwhelmed or, anxious, that she could realize that connection to that then she knew she could do something about it. And I really resonated with that too, that connection to self to go, oh, I'm feeling this and that's okay, instead of
mm.
trying to aim for this, this bliss of calm.
And it doesn't always mean that something's wrong,
That's
because
right.
whether it's trauma or whatever, we have these interpretations we place on it. But feeling uncomfortable doesn't always mean that something's wrong. The flip side is excitement. When you have adrenaline in your system and your heart's racing, well, that's part of excitement as well. So we shouldn't always take it as a sign that we need to back off. Sometimes it's just a sign of our growth.
Wonderful. Well, we've got so much to talk about today. And I do want to take people on a journey with you, Tom, because even reading out your, introduction, there's so many layers to it. I'd love to go back to where it started for you as a young child, and even before you said you never ever imagined you would be a grief therapist. So let's go back to being a young kid, and that wasn't what you were dreaming to be. What was your childhood like? Were there moments where you started, when you look back now, you go, okay, I can see why I am where I am?
Definitely. I had a happy childhood. I was loved and well supported. I'm a triplet. I've got two brothers the same age. So that's a bit of an unusual fact there, but it kind of just meant that I always had someone to either play with or fight with. So that was always part of my childhood. But I was a curious kid. And I had this tendency to kind of ask big questions and think about big issues, perhaps before my age warranted it. And one thing that stands out very much for me, I was incredibly close to my dad's mum, my nana. And for a period in my childhood, Nana actually lived with us, and I loved it. It was like having your best friend sleep over every night. But one day I remember I started thinking about death, and just the concept had hit me. I was about 8 years old. And I remember Nana was doing some washing in the laundry and I was just chatting to her. But I was pondering this concern I had, what happens when we die? And I actually asked her the question. I said, Nana, what happens when we die? And she kind of got this concerned look on her face for a moment. And then she went back to putting the washing in the machine and she said, oh, Tommy, dear, it's just like going to sleep, but you don't wake up. Now, her answer didn't satisfy me. If anything, it made me a little bit more anxious because I just couldn't comprehend what that was like. So that sowed a seed within me of curiosity around why are we here? What actually happens to us? What's the purpose to all of this? Because living this life and having family and friends and all these hopes and dreams, and then you just go to sleep, that didn't resonate for me. So that theme was to play out in my life over many, many years after that. And then for me, I kind of pushed that to the side. And as a teenager, became very interested in car racing of all things. And I really just wanted to be a professional race driver. So I raced sprint karts and I tested Formula Ford cars and did a deal with my parents that, after high school, I want to have a year off. And this is going to be my year that's make or break. I'll have a good go of trying to be a racing driver. And if that doesn't work, the deal was I had to go to university and study something. So I spent a year sending out sponsorship proposals to companies and marketing plans and trying to get together the money to go racing. And it didn't happen. So the fallback was I had to go to university and study something. And the top of my list was psychology. So that then became the focus of my professional work for a long time. And at the heart, I think it's wanting to help people. It's a curiosity about how people tick. And so that was the beginning of what became a really fulfilling career as a clinical psychologist.
Yeah, tell us more about your clinical psychology career because, as I mentioned, you are an award-winning clinical psychologist, which is amazing. What was that in, and where did it lead you to being a director of Healthy Minds?
Well, it came out of my kind of frustration in doing clinical work with people. So, after I became registered as a psychologist, I was seeing clients of all ages for a whole range of different things. And that gave me a really broad appreciation of mental health and human functioning. But I noticed that many people shared the same blind spots in terms of aspects of themselves or what made them well and healthy in a psychological sense. And so I found myself teaching people the same kinds of skills over and over again. And I wanted to give them the same points of reference to be able to manage their own mental health. And as I was repeatedly going through this kind of toolkit of psychological skills with people, I remember one day I was about to launch into the same thing that I taught so many other clients. It was a lady who was sitting on my therapist's couch, and she was in some distress. And you can imagine that's not uncommon. People come for their first session and they let it all out. This lady was distressed. But I had this thought pop into my head, and I don't know where it came from, but the thought was, what would have happened for this person if she already knew the skills I'm about to teach her? And this was a real turning point because I didn't have a good answer. I wanted to know, could we have prevented this distress if we'd already, provided this toolkit in advance? And so that just bugged me. Like, I had this kind of, busy private practice. I had a waiting list of clients. I didn't really have time to be taking on other projects until it just got the better of me. And I thought, we have the potential here to create a kind of psychological immunization, a kind of preventive psychology. And when you think about other areas of health, when there's disease burden from health conditions, we have things that we do to prevent problems. And preventive dentistry is the best example because everyone brushes their teeth, it prevents a whole range of problems. What would be the psychological equivalent of brushing your teeth? So all these things were going around in my mind. And that led me to becoming what I refer to as a preventive psychologist. And it's not a commonly used name, unfortunately, but I ended up scaling back my private practice. I enrolled at Flinders University in a full-time research PhD. And it was all about trying to figure out, can we prevent anxiety and depression? Can we keep healthy people healthy? And so, through a great bit of work of really thinking about what hasn't worked in prevention, it became clear to me that unlike clinical psychology, where we've got these treatments that we've tested again and again, preventive psychology, there was no clear standard. Most of what was tried didn't work. And so there was an enormous gap to be filled there. So I had to think very carefully, what is it that we need to teach people that's different from what's been tried before, but that is going to help them have a healthy mind? That's really what the question was. And if we can give people these skills early in life or before they meet a really big stressor or a big overwhelming challenge, then we can actually have a prevention effect. And so I ended up working with hundreds of young people in a multi-site controlled trial, and this project took 4 years. I taught approximately half of these young people this toolkit of psychological skills. The other half, we didn't teach those skills, and we followed them over time. And so eventually, towards the end of my candidature, I remember sitting at my computer and pretty much was ready to push the button on our data analysis to see what had happened. And to my incredible relief, we did have a prevention effect. So we had a lower rate of onset of symptoms of anxiety and depression in this group who'd been taught these skills. We also reduced their risk for eating disorders at the same time. And we did it without talking about psychological disorders. We didn't need them to know what depression and anxiety was. We just needed them to have the right skills. And so that research was, it was recognized by Flinders University with the Vice Chancellor's Prize. It was published in one of the world's leading scientific peer-reviewed journals. And for me, this was, it was a bit of a breakthrough. So that then guided a whole range of work that we ended up doing with Healthy Minds. And I'm still doing that today, and it's incredibly fulfilling.
Oh, so brilliant, Tom, and congratulations. And I know that's where our paths crossed some years ago now. And when I heard about you, I was just incredibly excited. And I think, Tom, because I come from a sport background and a high level sport background, and I often say to people, I was introduced to psychology as a 14-year-old because I came through an institute of sport. And I then had access and used psychologists along my Paralympic journey, right up until I was 30 years old, to help become a gold medalist. And yet I wasn't offered psychology in any other aspect of my life. And generally, as we probably can say, or you could say as a psychologist, when people are worn out, burnt out, stressed out, grieving, suffering major trauma or distress. And internally, that didn't feel fair for me, that as an athlete, I got access. And not every athlete embraces it either. But that fairness has always bugged me. And so when I heard about your work, I was so incredibly excited to understand the impact that you're having, but also that you were there to help people to be their best, a bit like we are as athletes. People are a part of our team to help us be our best, and you are making this available to everyone, particularly to young people in schools and across the world.
Yeah, it's been very, very fulfilling work. And I mean, the best moments are when you have a young person in a school come up to you a little bit meekly, a bit shy, and say, "Thank you so much for teaching me this." Or kids that were, struggling with absenteeism, and then they'd always show up on the Healthy Minds Day. Or kids who have been in therapy and they've said, "I've learnt more from the Healthy Minds program than I did, with my psychologist for the last 3 years." That just gives me a real spring in my step. And you're right, it's about bringing it to everyone. We call the Healthy Minds program a universal approach, meaning it's not about segregating people who are deemed at risk for this or that. It's a toolkit we all need to have. And so we love teaching that. We teach it to adults as well through our corporate wellbeing programs and different things. But I think it's about taking sophisticated psychological skills and making them pragmatic. How do you use them? So yeah, absolutely love that.
So they can find out more on your website, and of course read your book Apples for the Mind, which is a fabulous book. To our listeners today, what's one thing, I know there are several layers, but what's one thing that you hear often, or those young people in schools that go, "Thank you, this bit really helped"? What's one thing our listeners could maybe think about today?
I think one of the biggest things that came out of our research is the power of self-compassion. For so many years, we've been told, society's been told, that self-esteem is the most important thing, that we have to feel good about ourselves and we have to evaluate ourselves favorably compared to others. And we saw this in trends in parenting and education since the late 1980s. There was this idea, if you praise people enough and give them lots of positive feedback, well, surely they're going to feel so good about themselves that they don't get anxious, they don't get depressed. But that turned out not to be true. That well-intentioned assumption is not true. We now know that self-esteem is moderately correlated with narcissism. It's possible to feel too good about yourself. So I'm not saying self-esteem is bad, but self-compassion is much better. So where self-esteem is how good do I feel about myself, self-compassion is how do I treat myself. So how do you treat yourself if you make a mistake, or if you have a bad day, or you're going through a difficult time? Do you treat yourself with the same kind of forgiveness and encouragement and kindness that you would your dearest friend? Or are you more hard-hearted and judgmental when it comes to you? And this was one of the powerful things in our results, because I believe our study at Flinders was the first large study in Australia to measure self-compassion in young people. And what we found was that those young people who were higher on self-compassion, on average, were significantly lower on anxiety, depression, and body image concerns. So it's this really broad, we call it a transdiagnostic protective factor. It's protective across different diagnoses. So if there's one thing that anybody listening can do for themselves to broadly reduce their risk for psychological problems, is to treat yourself kindly. And this is an antidote to the perfectionism that we see as a risk factor, where people are criticizing themselves and judging themselves and, holding themselves up to a higher standard than is reasonable. So self-compassion, treat yourself kindly. If you catch that moment where you have that judgmental thought, just stop and say, well, if this was my dearest friend saying that about themselves, what would I say to them? And what would I do that helps them?
Amazing, amazing, Tom. And also appreciating that we make mistakes as humans, right? Like making mistakes is a part of being human. And sometimes I know even from my experience of being a high performer and a high achiever that you can fall in that trap of, oh, only I make mistakes like that, and no one else would make mistakes like me. So realizing that it is part of being human. And I know for me, getting better at making mistakes, I try and share my mistakes with people now, not keep them in, because when I share them, people go, I made the same one. I go, oh, good. That's been really helpful too.
That's so powerful. When we work with leaders in our Healthy Minds work, one of the things we do, because we know perfectionism can be an issue in teams, so we often say to them, radical authenticity. Like I get people to do something I call failure storytelling. So I get them to share with another person within the workshop a time that they didn't perform well, made a mistake, stuffed something up, and the other person will reciprocate. But then after telling the story, I'll say to them, well, so how do you now feel about this other person? Do you now believe that they're untrustworthy, that they're incompetent, that you don't want to be associated with them? And of course, the person says, no, 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 it just humanizes them in my eyes. And now I feel more connected. So Kristen Neff, who is the professor who studied self-compassion, I think the most out of anyone in the world, she identified that one of the parts of self-compassion is common humanity. It's not seeing yourself as separate and isolated because you stuffed something up. These are the things that actually make us more the same, because to be human is to sometimes make mistakes.
Wow, that's another wonderful tool that you've given for our listeners too, to maybe try that activity with some of their people at work. So, Tom, I'm so interested to keep progressing along your journey, because I'd love to get to the conversation about you being a grief therapist now, and the journey. And maybe it does relate back to that conversation that you talked about with your nana that you put on hold, that curiosity of thinking about, well, this can't just be life. Where were the next nudges? Where were the next shifts that happened to you? You've got this successful Healthy Minds program. You're doing great research that's being recognized and awarded and shared across the world. Where does Tom's journey, where's the next nudge? What happens next?
Well, there's a step around the time I became a clinical psychologist, and probably coincided with the time that I started realizing, of all the presenting problems I might see from a client, the one that I kind of feared was grief. Because if someone has anxiety and depression, I've got tools. I've got, things that I know I can teach them that'll help them. But when somebody dies, that's not a problem I can fix, if you know what I mean. Like I didn't feel like I had the tools that would help people. And so I was developing this helplessness in the face of grieving clients. I mean, I would sit with them and I was willing to try to help them in any way I could, but I didn't feel like I was helping them in a substantive way. And that was my kind of secret shame, was that, this helplessness with grieving clients. I did my best, but I have to say, I'm sure I had more than one client realize that I wasn't probably that helpful and didn't come back. So this was like a little bit of this was a stone in my shoe that was going on. But around the same time, my dear Nana, who I loved, and we just had the closest relationship. She was my best friend growing up. And, you think of kids wanting to go and they want to have a sleepover at their friend's house. I would go and sleep over at my Nana's house, and she spoiled me endlessly. What happened around the time I became a psychologist is Nana died. And I feared this throughout my whole childhood. But as she got older, I thought, well, okay, she lived to 84. She had a full life. It wasn't like her death was going to be a tragedy in the sense of a young person dying. And so on that side of it, I kind of made peace with it. But I also thought, if there is something after we die, And I wasn't convinced by this sleep hypothesis that you just go to sleep and you don't wake up. If there is something, I'm going to hear from Nana. This was my belief. Of all the people in the world, she was the closest to me. Surely she'll let me know she's okay somehow. Well, months went by, Katrina, and there was nothing. No visit, no feather on the pillow, nothing that I had thought maybe would happen. And so, life kind of continued on. But then one day, and this would have been well over a year after she'd passed, maybe it was 18 months, I was coming out of sleep. I definitely was not dreaming, but I hadn't opened my eyes. And I saw her. And I could see her very clearly. She looked about 60 years old, not 84 when she died. She was smiling. She had bright red lipstick on and her auburn curls, and she was smiling at me. And I had this incredible feeling of love coming from her. And I said, Nano, you look great. I didn't really, I was so surprised. She didn't respond. She was just smiling at me. And then very quickly it faded out. Then I opened my eyes. I realized I had tears streaming down my face and the sun was just coming up. But this was the moment that I thought, if there's something, there'll be some kind of evidence of it. And what I'd experienced was what's called an after-death communication. Now, this relates very much to my later grief therapy because after-death communications are very common. They're very common in the regular everyday population. If we were at a dinner party or if you're walking down the street and you ask people, have you ever perceived the presence of a deceased person? Between 30 and 80% of people would say yes. So it's actually very common, but people tend not to talk about it because death is like the last taboo in our society. In fact, I have to tell you, I was speaking at a conference a few months back, and it was all psychologists in the audience. And I had them raise their hand at the start of my talk. Now, psychologists are always a bit nervous about being deceived because of social psychology experiments and things like that. But gradually, I insisted they all put their hands up. And I said to this audience of professionals, keep your hand up if you've ever perceived the presence of a deceased person. Well, 2/3 of the hands stayed up. So this is a very natural phenomenon. Most people report that it is comforting to them and helpful in their bereavement. And it's been studied in various ways since the 70s. So this all comes to cross paths with my hope and hopefulness around being effective with people in grief. One day I was taking a walk, listening to a podcast of all things, and I heard an interview with a Chicago-based clinical psychologist called Dr. Alan Botkin. And he was talking about how he'd been trained in trauma therapies and EMDR, which many people would be familiar with, eye movement desensitization and reprocessing. And he was an early adoptee of EMDR. It's where you have people move their eyes back and forth in a rhythmic way. It's very effective at reducing emotional distress. And it's now, even though people thought it was weird when it first came out, it's now really a gold standard treatment for post-traumatic stress disorder. Well, Alan Botkin was using this therapy with Vietnam veterans in Chicago. And he started trying to tweak it a little bit. He started trying to make it more effective. And because his client population had seen a lot of death, not only were they traumatized, but they also had grief. Either someone they cared about had died, someone innocent had died, or they'd even killed the enemy, and they felt grief about that. So he started trying to tailor his EMDR more towards these grieving, traumatized soldiers. And he noticed that when he got them to focus on their sadness, not just the traumatic event, but their sadness at the death, that it seemed to work even more effectively, he thought. And dramatically, their sadness would reduce. But one day, he was working with a soldier, a Vietnam veteran, and as his sadness was reducing quite dramatically, and after a set of eye movements, this particular client opened his eyes and reported that he had seen in his mind's eye, he had seen the object of his grief, an innocent Vietnamese girl he'd befriended who had been shot in the line of fire. Well, this soldier who had been hospitalized for his post-traumatic stress disorder was able to be discharged.
Wow.
And this happened again and again and again. And eventually, Dr. Botkin realized that he could put this into a protocol that was very effective at reducing sadness relating to grief. And it appeared to predispose people to having an after death communication. He called it induced after death communication therapy. So, hearing about all of this on the podcast, reading Alan Botkin's fabulous book called Induced After Death Communication Therapy, that was kind of the thing that I was looking for. So this stone in my shoe that had always bugged me, I thought, my gosh, I've got this spiritual part of me that's kind of hidden a little bit, and this professional kind of desire to help people. Finally, I can bring those together. So my training in induced after death communication therapy was like this, opened this second part of my career, and was the beginnings of some research and my book and a whole range of insights as well.
Wow, it's absolutely fascinating, Tom. I do know this story, and I've read your book, and I've bought books that you've suggested, and I've watched documentaries that you've suggested. And even hearing it again today, it is such an amazing journey of really, listening deeply to your abilities and then trying to line them up together for that greater good, to thinking about that purpose to really try and help people and give them that sense of giving their life back, particularly in that grief space where you felt like you weren't able to help them. Yeah.
Definitely.
Yes. So tell us more. Tell us more about you get inspired by this. What does Tom do? I know you'd been through 4 years of incredible research with young people. Do you then put your research hat on and go, okay, do I need to try and prove this? Like, what can you do with the skills that you've got and your sense of curiosity?
Well, the biggest problem with IADC therapy is that it seems too good to be true.
Mm.
So Dr. Botkin, amongst this Vietnam veteran population, was reporting occasions of after-death communications, which can be visual in the mind's eye, they can be auditory, they can be olfactory, they can be a sense of touch. He was having over 90% of his Vietnam veteran clients having these after-death communications. It's worth saying that the clients who don't have after-death communications still benefit from the therapy. The objective is to feel less sad, and almost everyone feels less sad from this therapy. But that was really my concern was, is it real? Sounds a bit too good to be true. And given it's dealing with a phenomenon that is what some people might consider a bit unusual or a little bit confronting, it's really important that I verify this for myself and that we add some scientific credibility to these claims of it being really effective. So that's what I did. So I trained as an IEDC therapist. I started doing some pro bono work with volunteers as I was building up my skills. I realized it was helping people. People were feeling a lot less sad after just two 90-minute sessions, which is unheard of in therapeutic terms. People were reporting some of these really comforting experiences. And then I thought, well, that's one thing, but we've got to actually do this in a serious scientific way. So I applied to become a visiting research fellow in the School of Psychology at Adelaide University and conducted a study of my own. So along with a colleague from Queensland, John Daniels, a psychologist there, we saw 43 people in a controlled trial where each participant, we measured their grief symptoms over a period of a month, and this gave us their baseline data. What was their level of grief, and was it stable? Then we gave them these 2 sessions of IEDC therapy, and then we measured their sadness and their grief a month later. So we had this pretty rigorous scientific design. And we recruited these participants and we saw them, some of them over Zoom, some of them we saw in person. And I have to say, the results were really remarkable because there's this thing in the social sciences in research called an effect size. And it's a measure of what is the kind of numerical change in something. So we measure grief, we measure sadness, and we report this data. Well, if you had a therapy like a cognitive behavior therapy or something that went for 10 sessions or 12 sessions, if you got an effect size of zero point 0.6 or zero point 0.8, you'd be pretty happy with that. That's, zero point 0.8 is considered a large effect. Well, what we found in these two 90-minute sessions with the IDC protocol, we were getting an effect size in terms of reduced grief symptoms of 1.56.
Double.
So basically double the
Wow.
effect of a regular therapy, but in two sessions. People reporting feeling a lot less sad, feeling lighter, feeling better able to move forward in their lives. And 79% of participants, when we said, did you at all perceive the presence of a loved one? 79% said yes. So, and these were regular, everyday people who just wanted some help with their grief. And that paper, I'm very excited to say, has just been accepted for publication. So we did verify it. We've contributed a major piece of evidence to that field. And yeah, it gives some credibility. If you're a grief therapist and, IDC therapy is not for everyone, it can be very intense for the client. But it's kind of an ethical consideration. If I've got treatment A and treatment B, and treatment A's got stronger evidence, I need to consider it as an option.
And how do you feel now, Tom, when because you're available, people can book in sessions with you in this space. How do you feel now when someone walks in the room and tells that story from before to now?
I'm thrilled. I'm excited.
Yeah.
It's completely different. I'm seeking out grieving clients now because
Yeah.
I know I can help them.
Yeah.
It's completely changed my view. So, I think I still very much love my Healthy Minds work and continuing with that, but I've got this kind of
Yeah.
second passion with IADC therapy and helping people with grief. So, there's some really exciting things happening on that front in terms of the international governance of IADC, and I'm going to be involved in that starting this year. And I just think there's so much potential to help people. 10% of grieving people will experience, or thereabouts, will experience what we call prolonged grief, where they feel stuck in it. They it's kind of stays with them and it impairs their functioning. Well, that's millions of people. So we need to get the word out. I feel like it's an ethical obligation for us to get the word out and to try to help as many people. But it's completely changed the way I see grieving clients.
Absolutely. And I really encourage people to read the book because I found it incredibly fascinating on all levels. And I'm not sure, Tom, if you can answer this. When people do get stuck in the grief and they get stuck in the sadness, that sense of being able to block the love to that person, or they get stuck in the emotions, can you explain that a little bit more for me around what grief does for people and where they get stuck?
Yeah, I think it's when people feel stuck in grief, it's not a character flaw, it's not a moral failing, it's not a mental illness in the typical respect of it. It's just part of our human foibles when we love someone so much and then it feels like they're gone. There's no absolute right or wrong way to grieve, and it's different for everybody. So I'm not a proponent of the stages of grief model and all of those things because it's made us too rigid in the way we think about it. And that's part of what can cause people to feel stuck is they have perhaps rules around grief. So some people feel very conflicted. They'll say, well, on one hand, I don't want to feel this pain. But on the other hand, what would it mean if I laughed or, was active in my life or I embarked on a new relationship or a new job? And so sometimes our expectations of ourselves, I've heard it said before that, the measure of our love seems to manifest in the measure of our sadness and grief. But that belief can sometimes hold us back if we think we must hold on to the sadness. The other thing that's really become apparent to me, and this has hit home for me personally recently, is all through near-death studies, whether it's near-death experiences, after-death communications, and I think science is really broadening its mind to these important areas of study. Those beliefs we have just about death really come to bear on it. So I think that one of the most distressing beliefs we could have is that when someone dies, they're completely lost to us. They cease to exist. They're gone. That's naturally a very distressing belief to have.
Mm-hmm.
But we now have.
So then let's not think about it, because that is too hard, right? So let's just not have the conversation. Yeah.
So it becomes a taboo. We'll
Taboo.
avoid talking
Yeah.
about it. We're
Yeah.
not, it's and it is a taboo in our society. And people worry that if they had a belief of an afterlife, and I'd like to suggest there's now an incredible amount of evidence to suggest that there may be an afterlife, that changes the way we see that. So if we go way back in time with grief therapy and grief counseling, the old view was that someone just had to accept the loss, almost push that person out of their life, and move on. And this acceptance of the finality of the loss was, I think, amongst some therapists, seen as the goal of therapy. That's completely changed. So research now suggests that if someone has a sense of ongoing bonds, a continuing presence in some way. Now, it doesn't have to be in the form of an after-death communication. For some people, it's holding on to rituals or meaning or memories, the way that person's influence lives on in your life. Or it can be a sense of appreciating a presence of that person. This is all associated with better coping and people adapting to the loss. So it's not about cut it off. It's about how can I make meaning from the loss? And if I have a sense of continuing bonds, that's for many people very, very helpful. So we've completely changed the way that we think about dealing with death and loss and grief. So for me personally, this has come home to roost because just about 4 weeks ago, my dad died, and he'd been ill for a period of time. It still happened fairly quickly. And when I reflect on that and my research, my work with clients and everything, I thought, how does this come to bear on my life when I experience a loss? And I observed in myself that my distress was around his pain and his confusion and all of those stressful and difficult things leading up to his death. But from the moment he died, and I was, the time I spent with him, I felt an incredible sense of peace. Now, not everyone is going to feel peaceful after someone they love dies. But for me, all this evidence that I have seen, these personal experiences that I've had, what the research and my client stories, it all tells me and suggests to me that, well, it's not the end. Someone's physical form has died, but it's not the end. It's not the end of the relationship. It's not the end of that connection and love. And when we process sadness in therapy, I have this image in my mind of dissolving it. It's almost like an ice block going to water and then to steam. If we can dissolve it through bilateral stimulation with eye movement or other means, we get this layer of sadness out the way, and what's underneath is love. And we can access that feeling of love and gratitude and peacefulness and acceptance. And that's just a new way of, and I think a more hopeful way of thinking about death.
Tom, thank you. Thanks for sharing that, and thank you for sharing about your dear father. And I know even reading your book, that really helped me in processing grief that I've had around when you interviewed and shared stories of people that had a near-death experience. So they passed, but they came back. And the things that they shared can really help us. I think for me, hearing all those stories that you shared has helped me in that space. But it's also helped me to think about, how can I live more aligned? How can I enjoy love and peace and life in its fullness, with knowing that we live and we die? And I love the part of the book that you talk about the lessons that we can learn from grief, from people who have had near-death experiences, about what we can do. And I'd love for you to share some of those insights from, where you are to this point in your life right now, from the study that you've done, from the losses, the near losses, from hearing so many people's stories. What are some things that we can do starting this new year that can really help us to live well and fully?
Well, the good news is there's heaps we can do, and the field of near-death studies gives us so many rich insights into that. If we're open to this parapsychology or spiritual reality, our whole existence, what does it tell us? Well, having read and studied so many cases of near-death experiences, what we notice is that there are commonalities in their experience. So you might say, well, someone telling you a story of their experience, that's just an anecdote. So some people who are following scientism, they're kind of dogmatic scientists, might dismiss that. But if you have many, many hundreds and thousands of cases with similar characteristics, that becomes a kind of scientific evidence. And it's telling us something. So in 1975, Dr. Raymond Moody, a psychiatrist it was originally from Georgia, I believe, in the United States, wrote a book called Life After Life. And he was the first person to coin the term near-death experience. And he found there were all these common features, many overlapping features in case studies of people who'd died. And this was also around the time, from then onwards, and it sort of became more apparent, I think, in the 1980s, we got better at cardiopulmonary resuscitation. So there were more people coming back from the brink to be able to tell these remarkable stories. Often they had experiences of incredible peace and love. They retained their personality. They had a sense of incredible well-being and connectedness with the universe. They generally didn't usually regret being in that state. They felt so good, unencumbered by pain or physical limitations. But one of the features that Dr. Moody found was very common was something called a life review. These people would experience visually and emotionally almost like a movie of their life, but it was experiencing it also from the other people's perspective. So how did you influence others? How did they feel when they interacted with you? Was their life helped or harmed for your influence? And this became the consistent content of life reviews. It was never about your degrees, your achievements, your assets. It was never about that. It was about what did you do with your life in terms of helping and influencing others. So this tells us so much that we can apply in our day-to-day life. I say in my book, the little things are the big things. It's those moments of interacting with others. It's the decision to return the phone call or not, or take time to play with your child, or whatever the case may be. These are the things that from this broad perspective really matter in life. And it actually led me to develop a practice I do, and I think it's made me a more spiritual person, that I call the day review. So if I can reasonably expect that when I die, I'm going to have a life review, and the measure of my life is probably going to be related to, did I positively influence others or not? How did they feel? I don't want to lose track and just say, well, that's too far away and not use those lessons now. So the day review is something I try to do every night before I go to sleep. Sometimes I fall asleep before I finish it.
That's okay. Self-compassion, Tom.
The day review is simply in your mind, going through the day that you've just had, just kind of reliving it in your mind mentally. It only takes a few minutes, but taking note of all the significant interactions you've had. So when you got up in the morning, who did you speak to? What did you say? What did you do? Who did you meet with that day? Who was on the phone? Just really reviewing those interactions. And you're reviewing it just from the perspective of, how was the other person influenced by you? How did they feel? Did they benefit? What was your intent? So it's not always about making someone feel good, because sometimes our interactions don't make people feel good, but we have to do them. But it's about your intent, the why as well. And as I was doing the day review, I noticed, firstly, I was judging myself pretty harshly and I had to use the self compassion. But then I started thinking about my day review during the day. So I would be about to make a decision, or I would be in the midst of a conversation with someone, and I would pause, and it took me out of this kind of self-centered, selfish view of the world, and I started thinking more about others. And this is a profoundly spiritual shift, I think, because it feels like time slows down. And you notice opportunities where you can be there for someone if you respond in a particular way, where previously I might have missed that. And so for me, doing the day review is about me noticing, did I get the little things right? Because ultimately, all this spiritual evidence we have, this somewhat scientific evidence of, a possible afterlife, tells us that it's those little things that really matter. So I recommend the day review.
Oh, Tom, I just love that. I even had goosebumps while you were telling me that whole story. That really touched just all of me and that spiritual side of me. And thank you so much for, using your incredible abilities that, you've been born with, that you've been able to take along your journey with the beautiful people that were in your life to go and ask questions and explore and, be inspired by people across the world to bring your abilities together to help others to live fully and to experience, the joy of what it is to be human in all facets. If we go back to thinking about psychology, and if we go back to that whole circle, I mean, that's what a psychologist does, right? It's looking at all facets of what it is to be human, and bringing this spiritual component in now with your work as well is really looking at the absolute whole.
Mm. We need, I've always thought we need to broaden our perspective of human experience and how we can help. Looking at the whole person is not just about their thoughts and feelings. It's about our complete reality, and that includes for many people a spiritual element. And when I think about that, and thank you for your kind words, I think about, the greater good and how can people apply this
Yeah.
for the greater good. And this is what all these insights are telling us is your influence for the greater good. That's it's that multiplier effect and that ripple effect that goes throughout the world. And I guess the other thing that now informs the way I approach life is, and this might sound a little bit unusual, but I mention it in my book, it's this idea that our lives are not about us. And it's almost jarring a bit to hear at first of all, because we live in this society that's very individualistic, and it's about how do we fulfill our potential, and how can I be the best person I can be. Well, that's good, and I want to be the best person I can be. But this really came about from a philosopher called Dr. Bernardo Kastrup, and he's a fascinating guy the way he sees the world. But when I heard this metaphor, it completely made sense to me. He said, imagine that you've got a blossom on an apple tree, but the blossom, the flower, believes that its life is about it, just itself, and it tries not to die. That seems preposterous, really, because it's part of a broader organism. And if the blossom tries not to die and not to fall off the tree, well, there's no fruit, there's no propagation of the tree, and there's no whole. And I see that in that regard, yeah, our lives are not about us. Yes, we need to do the best that we possibly can in our circumstances, but ultimately we're not responsible for all of it. We're not responsible for everything. And maybe this is a part of self-compassion as well, is that we are part of a whole. We're a blossom on the tree. And so our job is to play our part for the greater whole. So if that means being aware of our influence on others, if it's about making a decision to go down path X or Y, well, that should be informed by what is for the greater good. And this is the thing that I think helps us to have what I call in my book a beautiful death. Is that it's the peace you have. If you have that peace in your heart, that's not anything you can buy. That's not anything someone can just give to you. But it's that peace in our heart that allows us to say, well, I've played my bit. I've done my bit as part of the whole as best I can. And I think more than anything, that's what I want to guide my life through this year and beyond.
Stunning, Tom, because we just never know when this life, this physical life, will end. And I know personally I've worked very hard on that, and traveling to Nepal over the last 11 years and having some guidance through my Buddhist teacher and understanding one of those Buddhist principles of not being scared of death. Death is a part of the journey. And when you can get comfortable understanding that we're living, but we're also dying, and that it's something not to be feared. And when you can meditate on your death, you live fully in this next breath, and you live fully and you enjoy life. And learning from Buddhist masters, and then having the amazing Tom Nehmy, who lives in the same city as me, who has been living in service of others, and then you're now sharing these incredible learnings, but practical ways in which we can put into action today. Thank you so much, Tom. Thank you for the work that you do in terms of leading for the greater good, that inspired leadership for the greater good. And thanks for being a psychologist that's being able to make this accessible, preventable, but in a language that you can go, I can do this today. So thank you. Thank you for everything that you do.
Katrina, it's a pleasure, and I've loved having this chat with you, and I love the fact that by talking together, we can hopefully inspire others as well. Thanks for having me.
Oh, absolutely. And you'll see in the show notes exactly where you can read this book, because let me tell you, you'll want to read it and you won't want to put it down. I absolutely loved it. Check out Tom's work, check out Healthy Minds, and find out how you can learn more and do more for this wonderful year ahead. Thank you. Thanks for tuning in to the New Day podcast. For more inspiration and tools to lead for the greater good, visit newday.world. Keep leading with purpose, and we'll see you next time.